Many people want to know, does whitening really work? We have some before and afters to show you what whitening really does for your smile or your family and friends. Let's check them out. Many people ask, after teeth whitening, what are zingers? Zingers is when you get sensitivity or a shocking sensation or a lightning bulb right in your teeth, whether when you breathe air or whether you're drinking something cold and you're like, oh my gosh, what is that? And we're gonna answer a few questions that people have on how to prevent zingers in the videos to come. Many people want to know, after teeth whitening, can we still stain teeth? Can teeth be stained? Of course they can. If you're someone who loves to indulge with wine with your food, teeth could stain. If you're someone who likes colored foods and Snapple and other drinks that are colored, you definitely could stain your teeth. Coffee drinkers, especially green tea, teeth could stain. Anything that could possibly stain teeth is something that's colored. So after teeth whitening, it's highly recommended for about a week or two, you refrain from drinking too much colored drinks or eat anything that's colored. And that's how you prevent teeth from staining, and you keep your teeth whitening, the effects of whitening, for a very long time. Many people want to know the difference between deep stains and surface stains on teeth. Well, surface stains is anything that you could go and brush your teeth with, or you could go to a dental office and get a professional cleaning with. Deep stains are something that stain your teeth internally, and usually you need a whitening, a session of whitening to get rid of some of the deep stains. Deep stains sometimes develop over years, and the best way is to get a teeth whitening after you get a professional dental cleaning. Many people want to know, when is the best time to whiten your teeth? Is it 2 weeks before an event, 1 month before the event? And the answer is both. If you're someone who has a party coming up and you don't have sensitivity, 2 weeks or a week before your event is amazing, so that you have that fresh smile. But if you're someone who constantly has teeth sensitivity, or you're someone who eats a lot of acidic things, or you're already using a whitening toothpaste, you want to do a whitening a little bit earlier, 3 weeks to a month before your event, so that any effect, any zingers or stinging or shocking or bolt sensation into your teeth doesn't develop during your event. You want to have time for your teeth to calm down and relax, and your nerves to calm down. So about a month before your event would be ideal. And the best thing is to avoid food or drinks that have coloring and could stain your teeth, so you can have that crisp white shine during your party or your holiday event. The most important question is, how often should you whiten your teeth? Well, the ideal thing is to not to whiten too often. You do a whitening and you may want to wait 6 months to a year before you do whitening again. A professional whitening should last you up to 6 months to a year. All depends. If you're someone who has wine or coffee or tea and you stain on the surface often, you may need often whitenings. If you're someone who avoids stained foods or drinks or anything that's coloring in it, you may not need to whiten for a year or 2 years even, sometimes up to 5 years. It all depends on the diet. So look into your own diet, see if you have anything that could stain your teeth, if you have internal stainings already, or if you have events coming up, and that should guide you on how often you should be whitening your teeth. Many people suffer from sensitivity. Some people still want to get a whitening because you have an event or a party. Now everyone asks at the dental office, can I take some medications that could calm my nerves? The best medication would be anything that has ibuprofen. Ibuprofen is the active ingredient in Motrin or Advil, and they're great to decrease your sensitivity. So about half an hour before your whitening, if you take a Motrin, it should help with someone who has severe sensitivity or mild sensitivity. It's basically a preventative approach. During your whitening procedure, you might want to hear this. There's a protocol to decrease your chances of having sensitivity, especially if you're someone who's suffering with daily teeth sensitivity. Number one is you want to take out of your diet anything that has acid in it. Lemons, oranges. You want to limit lemon water because that removes your enamel and causes sensitivity. Also, you want to get on a regimen of Sensodyne, which is the most famous toothpaste to decrease sensitivity. Sensodyne either calms your nerves or blocks the pores that lead to your nerves, so that way you decrease your sensitivity on your teeth. That's an amazing regimen for about 2 weeks before you actually whiten your teeth. Also, during a whitening, you might take an anti-inflammatory such as Motrin or Advil, which have an active ingredient of ibuprofen. And all these things are an amazing protocol to have right before you whiten your teeth so that you can get the beautiful shine for your event or just for your self-confidence without having the aftermath, the sensitivity, or the zingers of your teeth being shocking or electrically being irritating. If you'd like to have more content, check us out on our website, dentalonlinecourses.com, or visit us on our Instagram page. Here's the information.